Welcome back. This is Maggie Mann with Southeastern Idaho Public Health, and today we have Kathy Puckett, who is our WIC director here at Southeastern Idaho Public Health. And WIC stands for Women, Infants, and Children. It's a wonderful program to help support families with pregnant women and with children under the age of 5 and breastfeeding women. And so we're going to just talk with Kathy today. Kathy is a registered dietitian, and so she has a vast knowledge base about nutrition in general, but in particular for those groups that benefit from WIC. So Kathy, thanks for being here today.
Welcome, thank you.
Yeah, so tell us, what is WIC?
So WIC is a federally funded supplemental nutrition program, and you said it yourself, we serve women, infants, and children. We're trying to serve younger populations, younger families, to establish good, healthy eating habits early on. So that's our main goal.
Okay, and how does WIC help families?
So our main focus is education. We provide nutrition education, and we provide breastfeeding education and promotion and support. We also are able to provide food packages for our participants. And the food packages, I actually had to write it out because I don't have everything that we provide listed, because it's a lot, honestly. So we, in Idaho WIC, we provide fresh fruits and vegetables, breakfast cereals, eggs. We have whole grain options such as breads, tortillas, brown rice, and pasta. We can provide canned or dry beans, dairy items like milk, cheese, and yogurt,
Okay.
peanut butter, fruit juice, canned fish, and infant cereal, infant foods, and of course infant formula.
Okay, so that's a huge help, I would think, because
Yeah.
any number of those things tend to be a little bit more when you're looking at like trying to shop on a budget and being economical. Some of those things can be at the higher end of the price range, so that's really a great support for families.
Yeah, absolutely. To put that into perspective, the average dollar value of a WIC voucher is maybe $75 a month.
Okay.
But it can vary significantly, because when we provide specialty infant formula, that can be over $200 a month.
Wow.
So it really does help. It doesn't seem like a lot by maybe just getting a food package. And another thing that happened is during COVID, they increased the dollar amount that we could give to our participants for our fresh fruits and vegetables. So pre-COVID, they were allowing $9 a month for children and $11 a month for women. Well, it went up to $25 a month for children and $40 plus for women.
Wow, that's pretty amazing.
Yeah.
I'm sure that clients really appreciated that.
I think that's something that we did get a lot of feedback on. That was probably one of the best improvements that clients were telling us about.
So when we talk about those food packages, is it kind of a one size fits all, or are people able to like identify and pick the things that they would like to have included in their food package?
That's a great question. So we do have base food packages, like a pregnant woman isn't going to get the same as a postpartum woman. An infant isn't going to get the same as a child. So we do have some base food packages, but we are able to do some customization. Like if someone needs lactose-free milk, we can do that. We can provide soy milk. If they have allergies, we can say, well, you can get to, like, say, gluten. We could say, well, you can get the corn tortillas, that is a gluten-free, or the brown rice. So there are some ways to modify their food packages.
Okay, that's good to know. And then like with the fresh fruits and vegetables, is that something that the program specifies, or can they go to the grocery store and say, well, today the broccoli looks really good, so I'm going to get broccoli, and maybe the next time they get something like Brussels sprouts or cauliflower or something like that? Is that how that works?
Yeah, that is, we actually, they get to decide. So if they walk into the store and they see that Brussels sprout, and they can choose that. It's not, it's just a dollar value.
Okay.
So they can spend up to the amount on their card. If they spend over that amount, they just pay for the difference.
Okay.
So,
Okay. And so who is allowed to participate in WIC? Like,
Okay.
what are the qualifications or requirements?
really easy to decide, to determine eligibility in WIC. One, you have to be categorically eligible, which is women, infants, or children.
Okay.
Specifically for women, we serve pregnant women,
Mm-hmm.
we serve postpartum women up to 12 months after the delivery of their infant.
Okay.
And then infants and children up to the age of 5. So that's who specifically can participate in WIC. But then we also have the other family members can participate in WIC appointments. They may not be receiving the food package, but they can receive the education that we're providing.
Okay.
So we always encourage family members to participate in the information that we provide.
Okay. So can you give an example of like what is a WIC education topic?
Yeah, sure. Well, just off the top of my head, say we are conducting an appointment and we find out that a 2-year-old is still using a bottle.
Mm-hmm.
We would probably say, hey, here's reasons why we encourage you to wean, and here's some tips on how to do that. We can provide a handout, which we provide by text these days since we're doing phone appointments. So what we do is during an appointment is we try to identify anything that's relevant to the client. So yeah, picking up the topics that we provide education on are kind of revealed during the appointment.
Okay.
So our goal is to provide relevant education, not just like, oh, this is a 6-month-old, we're going to start talking about foods or whatnot. So
it's kind of tailored to the individual participant.
Yes, that's
Okay.
definitely the goal.
Okay, that's great. So what can let's say a person signs up for WIC, is eligible, what can they expect during an appointment?
So COVID has changed so much. We are completing appointments by phone right now.
Okay.
And for the foreseeable future, we have been told that we can expect that. So clients might have to come into the clinic initially just to pick up their WIC card.
Okay.
And this is the Idaho WIC card. I don't know how well anyone can see it, but
So it looks just like a debit card.
it's a debit card.
Mm-hmm.
The picture is of Redfish Lake in Stanley. So we wanted it to be very specific to Idaho.
Mm-hmm.
But yeah, that's when they might have to come into the clinic is
Okay.
to pick up their card. But everything else is we're completing over the phone. We even have it so that they're able to send in their proofs, like proof of address, proof of identification, and proof of income. They can submit that over the phone. I mean,
Okay.
in a text to us.
Okay.
So
So in that appointment, are there like assessments that are happening? Like what kinds of questions do people have to answer?
Yeah.
Those kinds of things.
well, we have multiple questions we ask, and they're all just health-related questions. We're trying to assess their habits related to food intake, related to physical activity, related to things like even brushing teeth. And so it is an extensive questionnaire, and sometimes it feels intrusive, but we really are just trying to provide the best kind of education we can get. So we need to get information before we can provide information.
Sure. So what do you think the most important benefits of WIC are?
I think one of the main benefits for our community is that the federal dollars from WIC that come in are supporting our local community. Southeastern Idaho Public Health WIC program brings in roughly over $250,000 in food dollars quarterly. So we are helping to provide our local economy. And we're not taking from someone else in Idaho. You know, participation in WIC is something that clients, it helps the community. It doesn't take away from someone else. And I think that's not really well understood. A lot of people think that there's just one little pot of money and that if they use it, they're not going to allow someone else to use it. But I would tell people that we need participation because we are funded based on participation. So when people come and use our services, we can maybe actually get a bigger grant next year to help more people.
And the requirements to be able to participate in the program are actually pretty high, aren't they? Like the
Yes.
income guidance?
Yeah. WIC income guidelines are 185% of poverty levels. And to put that into perspective, Medicaid is 130%. So you can actually make more money and still qualify for WIC. So there's kind of a little safety net there because sometimes people who don't quite qualify or just a little over income for Medicaid, they can still come and see if they qualify for WIC. And WIC also, if you are currently receiving Medicaid benefits, then you're automatically income eligible to receive WIC benefits.
Okay.
So that's one less proof that you would have to provide.
Okay. So if somebody is interested either for themselves or a family member or a friend, what should they do?
The best thing to do is go to signupwic.com.
Right here.
And that is nationwide. That is not specific to Idaho. You can find information about the nearest WIC clinics. It will give you the contact information, who you should call to get you started. And it has general information about WIC. It's a great resource.
Okay. So essentially, to sum it up, WIC provides relevant education and food packages to kind of it's not your food for the whole month, but it's supplementing the food that you're able to purchase on your own. It's healthy, nutritious options, and it just helps people help their families.
Yeah, and I forgot to tell you about our peer counseling program. WIC really encourages breastfeeding, and we have some people on staff who their job is to just try to support our moms who are choosing to breastfeed. And another great thing is that we can provide breastfeeding equipment. We have electric breast pumps that we can provide to our clients who are qualified, and that's just a huge cost saving right there.
Yeah, that's such an important help because as our society has gotten more mobile and you're not necessarily around your own mom or your grandma or your aunts, you don't really always have the support that people traditionally had. So that kind of support through the peer counseling program is really critical.
Yeah, I agree.
Okay. Well, just to sum up, Kathy, why should people check into WIC if they think they might qualify?
I just think it forms really good habits early on in our younger families. I think that WIC is only available for a certain amount of time. When your kiddo turns 5, they graduate. And so it's just a good program that helps our young families in our community. So I would encourage anyone to check into WIC, or if you know anyone who you think might qualify, check out the income guidelines. They're higher than you think.
Okay. Well, again, here's where you can go to check out if you're eligible for WIC, and it's signupwic.com. And so, Kathy, thanks so much for being here today and sharing information about this great program. We're very appreciative. And for everybody else out there, thanks so much for tuning in. And until next time, take care.